My goatee goes way back to medical school, and I'd really not grown any facial hair up until that point. And in medical school, it's fairly intense, as you can imagine. I found that I was on my rotations and I was becoming recognizable because I had this goatee. And when I actually got out into practice, it's been the same thing. A lot of people just don't remember their doctor's names, but if nothing else, they'll come in and say, "It was the doctor with the goatee," and they'll be like, "Okay, we know what you're talking about," because nobody else really has it. So I've kind of held on to it for that reason, and it's worked out well, and my wife likes it, so that also helps. I'm not a surgeon. I do not do any surgeries. I don't do anything in the hospital really, which is the way I like it. Part of why I chose what I do. What I do is a lot of non-operative orthopedics, and actually if you look at what most people's problems are, most of them aren't surgical. And so that's what I focus on, is the different treatments for getting these non-surgical things better, and a lot of these are chronic overuse things. Some acute injuries don't require surgery, and so that's where I step in. Sometimes this is injections, sometimes this is other treatments, physical therapy, and I help diagnose and direct those treatments to help get people better. And in my case, I always try to tell them I'm trying to keep you from seeing my partners. Our group is really special. We're a relatively small group in a small town, and we are all part of this community. Like, we are involved in it. Everybody in our clinic is involved in the community. We care about the community. We want everybody to be healthy and active and doing the things they want to do, and these are our friends and our family and folks that we see all the time. So I think we may have a little more vested interest in that than maybe some practices do. Our size in no way limits us from what we're able to do. In fact, we kind of feel like it's an advantage in many ways because we're able to do more. Each individual person has the different things that they can do and do it very well, and so we're able to really tailor that, and we're very available to the community, much more so than some of the bigger groups are, and so we really think it's an advantage as far as that goes. We keep people moving, and that's probably the biggest thing, is when you see somebody who comes in and whether it's a broken bone or an injured joint, and you get them back doing the things that they want to do, it's great. I mean, that's the thing. When you go home, I'm happy at the end of the day, and my wife's like, "Oh, why are you in such a good mood?" It's because I probably had some folks that kind of, I say, graduated from my care. They've gotten better. I cut them loose back into the wild, and they're back to doing things, and that's really fun. And that's probably the big part of doing what I do, especially with the sports medicine aspect. When I'm not working, I love spending time with my kids, getting outside, and as they're getting older now, we're getting to go fishing, and that was always a big thing when I was growing up. And just being outdoors is one of the reasons we love living up here in the mountains, is we can go out our back door and literally go on a hike. We can drive 10 minutes to a stream. We can get out to any number of places pretty quickly, and that's what we try to do, is be outside as much as possible and find some way or the other to do that.